Hello, my name is Duncan Wilcox. I'm a pediatric urologist and the Surgeon-in-Chief at Children's Hospital Colorado and the University of Colorado. In pediatrics, we're increasingly doing minimally invasive surgery. Whether it is laparoscopy, thoracoscopy, arthroscopy, or robotic-assisted surgery, the body cavity is approached through ports. These ports are usually 8, 5, or 3 millimeters in diameter. These ports enable us to visualize the part of the body that we wish to operate on. They're extremely good at enabling us to dissect out and remove or excise parts of the body. But increasingly, as we develop more skills, we are using this to do reconstruction. In reconstruction, we frequently need suture material, and this is where a problem exists. Unfortunately, the needles we use are often of a diameter that makes it difficult for the needle to go through the port, especially when we're using smaller ports. It frequently gets stuck either within the port or within the valve. And this has led us to do 3 things. The first is that we use a needle which is inappropriate, it's too small, and consequently we need to use a suture which is less strong. Secondly, we use the needle which we normally need and then bend it so that it can fit within the port. This leads to a problem in that it's no longer of the ideal shape to suture properly, or that it breaks, leading to significant difficulties finding the needle. Or sometimes we try not to use a needle and suture at all. Working with a team of engineers at CU Boulder at the Idea Forge, we have developed the idea of trying to create a needle that is deformable. The idea behind this is that we can create a needle and an introducer that goes in and out easily. It is of the correct shape when it's in the body, but can be straightened as it goes in and out. For the needle, we have developed using Nitinol. Nitinol is a nickel-titanium alloy which has a unique property in that its shape can be created, and then under force it can be deformed back to a straight line, and then once that force is stopped being applied, the needle returns to a normal shape. So once we developed a needle that could be correctly shaped and keep a point, we started looking at an introducer. The introducer needed to be able to go in and out of the port easily. It needed to be used such that the force applied could be easily transmitted to the needle. This is an introducer in which the needle goes in here and it brings into the device and so straightens it. This introducer allows us to insert needles and remove them time and time again so that we're able to place the exact needle we want at the point in which it needs to be used. We currently have a number of prototypes for both the needle and the introducer, and we have a patent pending. Our future plans are that we intend to seek funding to create a more marketable, more easily developed introducer and needle, in the hope that in the next few years we will have a product that can be used in clinical practice. Thank you very much for listening to me today. I would very much appreciate if you have any questions or suggestions to how we can improve this, that you contact me by email or by phone. Thank you.